Title: Masturbation, Understanding Its Effects, a Balanced Perspective. Introduction. Masturbation, the act of self-stimulating one's genitals to experience sexual pleasure, is a topic often surrounded by controversy, myths, and personal beliefs. While it is a common practice among people of all genders and ages, societal taboos and misinformation can make it difficult to discuss openly. This essay aims to explore whether masturbation is good or bad by examining its physical, mental, emotional, and social implications, drawing upon medical research, psychological studies, and cultural perspectives. We will present a nuanced and balanced view of masturbation and its effects on health and well-being. Section 1. The prevalence and normalcy of masturbation. Masturbation is a natural part of human sexuality. Numerous studies have shown that the majority of people masturbate at some point in their lives. According to data from the Kinsey Institute, over 95% of men and around 89% of women report having masturbated. It is considered a normal behavior by most medical and psychological professionals, including the World Health Organization. From adolescence through adulthood, masturbation is often the first form of sexual expression and can serve as a way for individuals to learn about their own bodies. It is also practiced by people in relationships and those who are single. The prevalence and normalcy of masturbation support the idea that it is not inherently harmful or wrong. Section 2. Physical health benefits of masturbation. Sexual health and function. Masturbation can promote healthy sexual function. For men, regular ejaculation may help reduce the risk of prostate cancer. For women, masturbation can help maintain vaginal health, relieve menstrual cramps, and increase awareness of what brings sexual pleasure. Improved sleep. Orgasms trigger the release of endorphins and other chemicals like oxytocin and dopamine, which help induce relaxation and sleep. Masturbation is commonly used as a natural sleep aid. Stress relief. The act of masturbating can help reduce stress and anxiety levels. The release of feel-good hormones during orgasm creates a calming effect that may help individuals feel better emotionally and physically. Safe sexual outlet. Masturbation is a safe sexual practice. It poses no risk of sexually transmitted infections, STIs, unwanted pregnancies, or emotional complications that sometimes accompany sexual relationships. Section 3. Mental and emotional aspects. Improved mood is mentioned. Orgasm releases endorphins, natural chemicals that create feelings of happiness and well-being. Masturbation can help lift mood, especially when feeling lonely or anxious. Self-discovery and confidence. By exploring one's own body and sexual responses, individuals often gain a better understanding of their desires. This self-awareness can lead to more satisfying sexual experiences with partners and improved communication about sexual needs. Addiction and compulsive behavior. While masturbation is normal, it can become problematic if it is compulsive and interferes with daily responsibilities, relationships, or mental health. Masturbation addiction, though not officially recognized as a clinical disorder, may share characteristics with behavioral addictions. It is essential to recognize when it crosses into excessive behavior that causes distress. Section 4. Cultural and religious views. Cultural and religious beliefs play a significant role in how masturbation is perceived. Some religious traditions consider it immoral or sinful, while others view it as a private matter. In conservative societies, masturbation may be associated with guilt or shame. However, these cultural beliefs often stem from traditional interpretations or lack of comprehensive sex education. Modern faith leaders and scholars in many religious communities are beginning to adopt more open and understanding perspectives. especially when masturbation is viewed as a safer alternative to risky behaviors. Section 5. Myths and misconceptions. There are many myths surrounding masturbation, including it causes blindness or infertility. There is no scientific evidence supporting these claims. Masturbation does not lead to physical harm when practiced in moderation. It lowers testosterone or weakens the body. Masturbation causes a temporary drop in testosterone immediately after orgasm, but hormone levels return to normal quickly. It does not cause long-term damage to strength or stamina. It is only for people who can't find partners. Many people in relationships masturbate. It is a personal activity that complements, rather than replaces, partnered sex for many. Dispelling these myths is important for reducing shame and promoting healthy attitudes toward sexuality. Section 6. When masturbation may be harmful while generally safe and healthy, there are instances where masturbation may have negative effects. Excessive frequency. When masturbation becomes excessive and interferes with daily functioning, such as missing work, avoiding social interaction, or neglecting responsibilities, it may indicate an underlying issue such as anxiety, depression, or obsessive-compulsive tendencies. Guilt and shame. People raised in restrictive environments may experience intense guilt after masturbating, leading to anxiety or low self-esteem. This is not a physical problem but a psychological one, often rooted in cultural conditioning. Impact on relationships. If masturbation is used as a replacement for intimacy in a relationship, or if one partner feels neglected, it can lead to tension. Open communication about sexual needs is crucial in relationships. Section 7. Healthy practices and boundaries. To ensure that masturbation remains a healthy part of life, here are some suggestions. Moderation. Like most behaviors, moderation is key. Masturbation should not interfere with daily responsibilities or personal relationships. Mindfulness. Practicing mindful masturbation can enhance body awareness and lead to more satisfying experiences. Avoiding porn addiction. Excessive use of pornography during masturbation may lead to unrealistic expectations or desensitization. Balancing visual stimulation with imagination and emotional connection is healthier. Talking about it, reducing the stigma by encouraging open conversations, especially in educational and family settings, can help promote a healthier attitude. Conclusion. Masturbation is neither inherently good nor bad. It is a natural behavior with potential benefits and risks depending on how it is practiced. It offers physical, emotional, and mental health benefits when done in moderation and without guilt. However, it can become problematic if it is excessive, compulsive, or causes distress. Ultimately, understanding masturbation requires a balanced perspective that considers individual values, cultural backgrounds, mental health, and lifestyle. Education, self-awareness, and open-mindedness are crucial in forming a healthy relationship with one's own sexuality. Rather than labeling masturbation as good or bad, it is more accurate to view it as a personal activity that can be part of a healthy life when approached thoughtfully.